What if I told you that one simple leaf could begin changing your fasting blood sugar in as little as a few days? Not in theory, not in lab animals, but in real people struggling with rising glucose levels. Right now, millions of adults wake up every morning and check their blood sugar with frustration. One day it's 118, the next morning it's 146, some mornings it's 165, even though dinner was careful. Even though medication was taken, even though they are trying. That quiet rise in fasting blood sugar is not random. It's insulin resistance slowly tightening its grip. After 40, after 50, your cells do not respond to insulin the way they once did. Your liver releases glucose overnight when it shouldn't. Your muscles stop absorbing sugar efficiently. Inflammation quietly builds inside blood vessels. And even when you eat less, numbers can keep climbing. This is where most people feel stuck. They increase medication, they reduce carbs, they walk more, yet their A1C inches upward year after year. Now here's where things get interesting. There is a plant that has been studied for its ability to reduce fasting blood glucose, improve insulin sensitivity, lower inflammation linked to diabetes, support long-term A1C improvement. That plant is Moringa. But before you assume this is hype, let's be clear about something. Moringa is not magic. It does not replace your medication. It does not cure diabetes overnight. But what it may do is something extremely powerful. It may improve the way your body responds to insulin. It may reduce how much glucose your liver dumps into your bloodstream at night. It may reduce post-meal spikes that slowly drive A1C higher. And if that happens consistently for weeks and months, the long-term effect becomes measurable. In this video, I'm going to show you exactly what happens inside the body when a person with diabetes begins taking Moringa daily. We'll break down what may happen by day 3, what changes by day 7, what many people notice by day 14, and what this could mean for your A1C after 3 months. We'll also discuss safe dosage, which form works best, and who needs to be careful, especially if you are already taking medication. Because if you're over 40, over 50, and watching your numbers rise despite effort, this conversation matters. So before we go deeper, I want to know, where are you watching from today? Drop your country in the comments. And tell me, are you managing diabetes, pre-diabetes, or just trying to prevent it? Stay with me. What you're about to learn may completely change how you look at this leaf. Before we talk about what Moringa does, we need to understand what is really happening inside the body of someone with diabetes or pre-diabetes. Because if you don't understand the problem, you won't appreciate why this leaf matters. Let's start with insulin resistance. Insulin is the hormone that moves sugar from your bloodstream into your cells so it can be used for energy. When you're younger, your cells respond quickly. Sugar enters smoothly. Blood glucose rises after meals and then returns to normal. But over time, especially after 40 and even more after 50, your cells begin to resist insulin's signal. It's like insulin is knocking on the door, but the door isn't opening as easily. So what happens next? Your pancreas produces more insulin to compensate. For a while, that works. Blood sugar stays borderline. Doctors may call it pre-diabetes. But slowly, the system strains. Your liver starts releasing glucose overnight, even when you didn't eat. This is why many people wake up with high fasting blood sugar, even though dinner was light. Your muscles absorb less glucose. Your fat tissue releases inflammatory chemicals. And inflammation is a huge part of this problem. Chronic low-grade inflammation makes insulin signaling weaker. It makes your blood vessels more rigid. It contributes to rising triglycerides and fatty liver. So even when someone says, "But I didn't eat anything sweet," their morning sugar can still climb. This is what frustrates people. They cut sugar, they reduce carbs, they exercise, yet their A1C slowly moves from 6.4 to 6.9 to 7.3 to 7.8. And once that happens, medications increase. But here's the key point. If insulin resistance is the root problem, then anything that improves insulin sensitivity can change the trajectory. Not overnight, but steadily. And this is where Moringa becomes interesting. Because Moringa contains plant compounds that have been studied for their effect on reducing blood glucose absorption, improving how cells respond to insulin, lowering inflammation linked to insulin resistance. Instead of just forcing more insulin into the system, the goal is to make the body respond better to the insulin it already has. That is a completely different strategy. And when you approach diabetes from that angle, things begin to shift. In the next section, I'll explain exactly how Moringa interacts with blood sugar at a cellular level and why some people begin noticing changes within days. Stay with me. Now let's talk about what Moringa actually does inside the body, because this is where most videos stay vague. They say, it lowers sugar, and move on. But how? There are three main ways Moringa may influence blood glucose, especially fasting blood sugar. First, it slows down how quickly sugar enters your bloodstream after you eat. Moringa contains natural plant compounds and fiber that can reduce how fast carbohydrates are absorbed in the gut. That means instead of a sharp spike after a meal, you may see a slower, more controlled rise. And when spikes are smaller, your pancreas doesn't have to overproduce insulin. Over time, that matters. Second, Moringa appears to support insulin sensitivity. This means your cells may respond better to insulin's signal. When insulin works more efficiently, glucose moves into muscle and liver cells more easily instead of staying in the bloodstream. Think of it like oiling a rusty lock. The key hasn't changed, the insulin hasn't changed, but the door opens more smoothly. Third, and this is especially important for people with high fasting glucose, Moringa may reduce excess glucose release from the liver. Here's what happens at night. Even when you are asleep and haven't eaten for hours, your liver releases stored glucose into the bloodstream. In people with insulin resistance, that release becomes exaggerated. It's one of the reasons morning readings can be frustratingly high. Some studies suggest that Moringa's plant compounds may help moderate this overnight glucose output. If that's true, and emerging research suggests it may be, then fasting blood sugar could begin stabilizing. Not because sugar disappeared, but because your body is handling it differently. Now, let's be realistic. If someone's fasting glucose is 180 every morning, Moringa alone will not bring it to 95 overnight. But what some people report, and what small studies suggest, is modest early improvements. Drops of 5 to 15 points in fasting readings over the first week. More stability, less dramatic spikes. And that stability is the beginning of long-term improvement. Because A1C is not about one reading, it's about consistent patterns over time. So if fasting numbers begin trending down, even slightly, and post-meal spikes are less severe, that creates cumulative benefit. In the next section, we'll talk specifically about what some people may notice by day 3. Because this isn't just theory, there is a timeline to how the body responds, and it may happen faster than you think. Now let's talk about something practical. What might actually change within the first few days? Because when people start taking Moringa, they don't want abstract science. They want to know what to expect. By day 3, most people will not see a dramatic transformation. But subtle changes may begin. The first thing some individuals notice is a smoother post-meal reading. Instead of a sharp spike after breakfast or lunch, the rise may feel more controlled. If you normally jump from 110 to 190 after a carb-heavy meal, you may see a smaller climb. Why? Because Moringa's fiber and plant compounds can slow down how quickly sugar is absorbed in the digestive tract. That doesn't eliminate carbohydrates, it changes the speed, and speed matters in diabetes. The second possible change is digestive stability. Some people notice less bloating, better bowel regularity, and fewer intense cravings. That may seem unrelated to diabetes, but it isn't. When digestion is steadier and fiber intake improves, glucose absorption becomes more predictable. Predictability is key to stable readings. The third change may be subtle energy improvement. When blood sugar swings are slightly reduced, energy becomes less erratic. Instead of feeling sharp crashes after meals, some people report steadier levels throughout the day. Now let's be clear, day 3 is early, If someone's fasting blood sugar is consistently high because of years of insulin resistance, it will not reverse in 72 hours. But small reductions, even 5 to 10 points, can begin appearing in some individuals. And those small reductions matter because diabetes progression is not about dramatic one-day events. It's about patterns. If post-meal spikes are smaller, your pancreas produces less emergency insulin. If your body requires less insulin, inflammation gradually reduces. If inflammation reduces, insulin signaling improves. It's a chain reaction. And day 3 is often when that chain reaction quietly begins. However, this is also where an important warning comes in. If you are already taking medication that lowers blood sugar, especially insulin or sulfonylureas, you must monitor your levels carefully because when natural compounds and medication combine, sugar can sometimes drop lower than expected. Not common, but possible. So by day 3, think of Moringa as a stabilizer, not a cure, not a miracle, but a plant that may begin influencing how your body handles glucose. And if that stabilization continues into the first week, that's when things become more noticeable. Next, we'll talk about what changes may appear by day 7, and why that point is often when people decide whether they will continue using it. Stay with me. By the end of the first week, patterns begin to matter. Day 3 is subtle. Day 7 is where trends begin forming. If Moringa is going to influence blood sugar, this is when you start seeing clearer signs. The most common early improvement by day 7 is more stable morning readings. Not perfect, but steadier. Instead of waking up at 165 one morning and 142 the next and a 178 the next, the range may begin narrowing. That narrowing is powerful because wild swings are what damage blood vessels over time. When fasting blood sugar becomes more predictable, it usually means one of two things is happening. Your liver is releasing less excess glucose overnight, or your body is using insulin more efficiently. Both are good signs. Some individuals also notice that post-meal spikes are not climbing as aggressively. Instead of peaking at 200, maybe it tops out at 175. Instead of staying elevated for 3 hours, it returns to baseline faster. That faster return is important. It reduces total glucose exposure throughout the day, and A1C is based on total exposure over time. Another shift that may appear around day 7 is reduced cravings. When blood sugar swings are smaller, the urge to snack constantly can decrease. This is not about appetite suppression. It's about metabolic stability. If insulin resistance begins improving even slightly, the body doesn't demand emergency fuel as often. There's also the inflammation factor. Chronic inflammation interferes with insulin signaling. Moringa contains antioxidants and plant compounds that may help reduce oxidative stress inside blood vessels and tissues. Lower inflammation supports better insulin response. Better insulin response means glucose enters cells more efficiently. That cycle reinforces itself. Now, this is where expectations must stay realistic. If someone's diabetes has been uncontrolled for 15 years, 1 week of Moringa will not undo that history. But if someone is in early diabetes or prediabetes, this stage is often where the numbers start trending in a new direction. And direction is everything. Because when readings begin trending downward instead of upward, confidence returns. And confidence drives consistency. Consistency is what lowers A1C, and when consistency continues into the second week, that's when the difference becomes more noticeable. Let's go deeper into what can happen by day 14. 2 weeks is where things stop feeling theoretical. By day 14, if Moringa is going to make a meaningful impact on your blood sugar, you usually begin seeing clearer evidence. The biggest shift many people report at this stage is fasting blood sugar that is consistently lower than where they started. Not dramatically low, but measurably lower. If you began at 150, 165 in the mornings, you may start seeing 130s or low 140s more often. That 10 to 20 point difference may not sound extreme, but over time it becomes powerful, because fasting glucose sets the tone for the entire day. When you start lower in the morning, your total daily glucose exposure drops. That reduces stress on the pancreas, it reduces insulin demand, and it slows the progression toward higher A1C. Another noticeable change by day 14 can be smaller glucose spikes after meals. Instead of climbing sharply and staying elevated for hours, the curve becomes smoother. This suggests that insulin sensitivity may be improving. When your cells respond better to insulin, sugar leaves the bloodstream more efficiently. And that is the real target in diabetes management, not just forcing sugar down temporarily, but helping the body handle it more effectively. There's also the anti-inflammatory angle. Chronic inflammation is deeply tied to insulin resistance. High blood sugar itself triggers inflammatory signals. Inflammation then worsens insulin resistance. It becomes a cycle. Moringa's antioxidant compounds may help interrupt that cycle. By reducing oxidative stress inside tissues, insulin signaling pathways can function more efficiently. That improvement may not be visible on the outside, but internally, it changes how glucose is processed. Now, here is something important. If you are on medication, especially insulin or medications that increase insulin release, day 14 is also when monitoring becomes critical. Because if Moringa is improving sensitivity, medication doses that were previously just enough may suddenly feel stronger. That can increase the risk of low blood sugar. So this is not a take it blindly situation. It is a monitor and adjust carefully situation. For people in prediabetes, day 14 is often where the biggest opportunity lies. At that stage, insulin resistance is still reversible. The pancreas is not yet exhausted. Improving insulin sensitivity early can delay or even prevent full progression into type 2 diabetes. 2 weeks is not the finish line, but it's where momentum becomes visible, and momentum sustained over months is what changes A1C. Let's now talk about that long-term impact, what consistent improvement means over a 3-month period. Now we move from short-term changes to long-term impact. Because fasting numbers and daily readings are important, but A1C is what truly defines progression. A1C measures your average blood sugar over roughly 3 months. It reflects how much glucose has been circulating in your bloodstream consistently, not just one good day, not just one bad spike. So here's the real question. If Moringa helps lower fasting glucose slightly, if post-meal spikes become smaller, if insulin sensitivity improves, what happens after 90 days? The answer is cumulative effect. A1C does not respond to one dramatic drop. It responds to sustained stability. If your daily readings are 15 to 20 points lower on average, and those lower readings persist for weeks, your A1C begins trending downward. For example, if someone's average glucose drops from 170 to 150 consistently, that shift alone can move A1C by several tenths of a point over a 3-month period. That may not sound dramatic, but in diabetes management, a 0.5% drop in A1C is significant. It reduces risk of nerve damage. It reduces kidney stress. It reduces vascular inflammation. It lowers long-term cardiovascular risk. And unlike medications that often work by forcing insulin release, improving insulin sensitivity addresses the underlying dysfunction. Now let's stay realistic. Moringa alone is unlikely to drop an A1C from 9.5 to 5.8. But in early diabetes or prediabetes, especially when combined with dietary control and movement, it may support measurable improvement. And here is something most people overlook. Consistency is the multiplier. If Moringa stabilizes your numbers enough to reduce cravings, if you feel steadier energy, if you avoid frequent spikes, you are more likely to maintain healthy habits. And healthy habits are what truly change A1C. There's also the inflammation component. Chronic inflammation interferes with insulin receptor function. Lower inflammation means insulin signaling pathways work more efficiently. That efficiency over months translates into lower average glucose, and lower average glucose translates into lower A1C. This is not overnight magic, it's pattern correction. The question is not, does it cure diabetes? The question is, does it shift the trajectory? If the direction changes, Even slightly, over 90 days, the long-term outcome changes too. And that's where the real power lies. But before we celebrate, we need to understand one more critical piece. How exactly does Moringa influence insulin resistance at the cellular level? Because that mechanism explains why some people respond strongly and others barely at all. Now let's go deeper. Because everything in diabetes comes back to one core issue: insulin resistance. If insulin resistance improves, blood sugar improves. If insulin resistance worsens, numbers climb, no matter how careful you are. So what may Moringa actually be doing inside the body? First, let's simplify insulin resistance. When you eat, glucose enters your bloodstream. Insulin acts like a key that opens the door of your cells so glucose can enter and be used for energy. In insulin resistance, the locks become rusty. The key is still there, but it doesn't work efficiently, so the pancreas produces more insulin to compensate. Over time, that constant overproduction exhausts the pancreas. Now here's where Moringa becomes interesting. Moringa contains natural plant compounds, especially polyphenols and isothiocyanates, that may help reduce oxidative stress inside cells. Oxidative stress is a major contributor to insulin resistance. When cells are inflamed or under stress, insulin signaling pathways become weaker. Think of it like static interfering with a signal. Reduce the static. The signal improves. By lowering oxidative stress and inflammation, insulin receptors may respond better. Better response means glucose moves into cells more easily. And when glucose enters cells properly, less remains circulating in the bloodstream. There's another layer. Chronic inflammation in fat tissue plays a large role in insulin resistance. When fat cells release inflammatory chemicals, they disrupt insulin signaling in muscles and liver. Moringa's anti-inflammatory properties may help calm that inflammatory environment. Less inflammation, improved insulin signaling, lower circulating glucose. That chain reaction is powerful. This is why some individuals notice steadier readings within weeks, not because sugar disappeared, but because the body is handling it more efficiently. There's also the liver factor. In insulin resistance, the liver continues releasing glucose overnight even when it shouldn't. If Moringa supports better insulin sensitivity in the liver, it may reduce that excessive glucose release. That directly affects fasting blood sugar. Now, here's the important truth. Not everyone responds the same way. If someone has advanced diabetes with significant pancreatic decline, the effect may be modest. If someone is in early insulin resistance, the impact may be stronger. The earlier the intervention, the better the response. This is why prediabetes is such a critical window. If insulin resistance can be improved before the pancreas becomes severely strained, progression can slow dramatically. And that brings us to prevention. Because Moringa is not just about managing existing diabetes, it may also play a role in preventing its progression when used correctly. Now let's talk about the group that has the most to gain: prediabetes. This is the stage where fasting blood sugar is creeping up, but not yet in full diabetic range. A1C may be 5.7 to 6.4. Doctors may say, watch your diet, but often nothing aggressive is done at this stage. And this is exactly where intervention matters most, because prediabetes is not permanent. It is a warning stage. Insulin resistance is present, but the pancreas is still functioning relatively well. That means improving insulin sensitivity now can dramatically slow, or even halt, progression. This is where Moringa may be most powerful. If taken consistently and combined with diet control and movement, Moringa's potential to improve insulin signaling and reduce inflammation may help prevent blood sugar from crossing into full diabetes range. Here's why timing matters. In early insulin resistance, the liver is only moderately overproducing glucose. Muscles are still capable of responding to insulin. The pancreas is not yet severely overworked. Improved sensitivity at this stage, and glucose control stabilizes faster. But once diabetes has progressed for years, pancreatic function declines. And at that stage, natural compounds may support, but not reverse, the process fully. So if someone is watching this with fasting numbers between 105 and 125, If your A1C is hovering at 6.1 or 6.3, this is not the time to wait. This is the window. Moringa may help. Reduce mild fasting elevations. Support insulin efficiency. Lower inflammation driving resistance. Reduce glucose spikes after meals.